welcome to A Prescription for Primary Healthcare, where we ignite discussions reshaping Canada's primary care landscape. I'm Tanya D'Addario, CMO at Healtheon, and your host for today's episode. Joining us today is Dr. Raymond Rupert, founder and CEO of Healtheon, who will provide an exclusive insight into his inspiring journey that led to the inception of Healtheon. Welcome, Dr. Rupert.
Hi, Tanya.
Let's begin by exploring your personal background. With over 40 years of experience as a family physician, your career has been truly remarkable. What motivated you to embark on a journey in medicine?
Well, I always enjoyed, helping people. And it seemed like, I like science and I like complexity, and I had some really strong role models when I was growing up. And so I was lucky enough to get into medical school at the University of Toronto, and voila, here I am 40 years later.
And then I guess it was, you did an MBA at some point after that?
Yeah, for some reason I like reading the business section of the Globe and Mail, so I thought, well, why not get an MBA? So I signed up for that one, and that was really beneficial because I learned how to run an organization.
And you've built a hugely successful business with RCM Health. You've helped thousands of patients navigate their complex medical issues. Then you decided to create Healtheon. Could you explain to our listeners what Healtheon is, how it came about, and how it was an offshoot of RCM Health?
Yeah, so I took what was a pretty vanilla family practice and decided I would focus on complexity. So it's very focused and used team-based care. We have 37 employees that work on teams and have about 4,000 specialists that work on teams. We added some IT, some computer systems and databases, and we were able, using advanced technology, enhanced administrative services, and team-based care, we're able to advance primary care into really a specialty called complexity care. So I thought, well, if I can do this with my family practice, why can't I help other doctors to modernize and upgrade their family practices?
And when you say modernize their family practices, what are we talking about?
Well, the administrative systems and the technologies being used in family practices probably date back to the 80s, maybe even earlier. Things haven't really changed. And now there's all kinds of really exciting AI-enabled technologies, et cetera, that can be used to improve administrative systems, patient flows, and really enhance the patient experience. And that's what Healtheon is bringing to primary care.
We have a tagline that we use at Healtheon that says, technology has changed everything except for your doctor's office until now. Why has the healthcare industry been so slow to integrate technology?
That's a big riddle, because it's the perfect place to apply advanced technology. And that's what Healtheon is doing. We're making it very easy for a primary care office to adopt advanced technologies and team-based care, which is the best type of care. And that's our mission. And we're well on our way to doing that.
So if we look at the value proposition for Healtheon, what are the main components and how will patients benefit?
Well, I think that patients really want to be able to access their doctor's office efficiently. So we'll be able to do that with AI-enabled technologies. They'll be able to get enhanced administrative services. They'll be able to access a team with nurse practitioners and physician assistants. And they'll have a better relationship with their doctor because the doctor won't be typing. They'll be talking into the computer and it'll be transcribing the notes. So all in all, the patient experience will be markedly improved, as will the doctor's experience.
Do you think we can relate the mission and what Healtheon is trying to achieve with better health outcomes for patients?
I think that Many of the doctors right now will say, you're here, one visit, one problem, but then what happens if a senior citizen comes in with 5 problems? The doctors just don't have enough time. But with team-based care, there'll be much more of an opportunity to visit all 5 problems, to take the time to dig in, and I think the outcome will be better care for patients.
And when we talk about team-based care, it seems to be a little bit of a buzzword these days in how to go about fixing our healthcare crisis. Why is it such an important concept to bring into healthcare?
Well, right now there's really limited capacity for patients. So I think about 6 million Canadians don't have a family doctor, and it's because there just aren't enough family doctors, and the family doctors that exist aren't operating efficiently. So if each doctor has a team with a nurse practitioner, physician assistant, an international medical grad as a clinical assistant, then the capacity to take on patients in a practice will likely double. And if we do that, then every Canadian will have the opportunity to have family practice.
I mean, there are currently 6 million Canadians without a family doctor. Is it fair to say that team-based care is a solution to tackling that problem?
Absolutely. Team-based care is an essential part of Healtheon's offering. And we've even developed a method of creating sustainable finance for the practice to pay for those services, in that we're going to be using monthly subscriptions paid by the client, the patient, to pay for team-based care.
And so how will this change and revolutionize clinics?
Well, I think that if patients have a better experience and they can get timely access, you don't have to call 10 times to try to book an appointment. And if the doctors are having a better work experience, and if the patients can talk about all 5 of their problems with trained staff, and if there's advanced IT to make things run more smoothly, I think we're adding the secret sauce to make it all work.
Kathleen Ross, president of the Canadian Medical Association, was quoted to say, "We cannot simply recruit our way out of this problem. We need to modernize how primary care is delivered to reflect the evolving needs of our population and those providing the care." How does this statement relate to Healtheon Solutions?
Well, first of all, we should hire her as a spokesperson because she's saying exactly what our mission is. And we will be signing up family practices, rolling out the technology, improving the patient experience, improving the doctor's experience, and helping a lot of Canadians.
How does what Healtheon is doing impact rural communities?
Rural communities are especially hard hit because of the absence of doctors and the long distances that patients have to travel. And so Healtheon will certainly have a virtual services to service people in rural and remote communities. And that will then integrate with our specialist networks, what are called virtual case reviews, with a network of over 4,000 specialists. And that will exist for both patients in rural, remote, or urban communities.
So the patient sees their family doctor, has an issue, does some imaging, and there's something that's questionable. How exactly do these specialists come into play?
So the Healtheon experts work with the family doctor and the team at the family doctor's office. And so all the data is uploaded to a secure cloud, all the imaging is. And then the specialist can review the data and work with the team, and in some cases even talk to the patient. And so we're getting accelerated access to specialists of all specialties. And that will exist for Canadians anywhere.
That is really big. What's the typical wait time to see a specialist in Canada?
Well, that, certainly varies by province. But this morning I spoke to a patient in Newfoundland who has a hernia. And I said, well, are you going to have an ultrasound done? And he said, well, the wait in Newfoundland is 8 months to get an ultrasound, which is kind of absurd. A neurosurgeon might be 2 to 3 years. A hip replacement might be 2 years. And so I think that we can really accelerate things by providing specialist access for folks that are registered in the Healtheon network.
Will it be accessible to all patients?
Well, it's an option. In other words, patients don't have to opt into Healtheon because there's a monthly subscription, kind of like Netflix. But for those patients that choose to opt in, they'll have expedited access to a whole series of services.
I'm curious to learn more about what the user experience will be like from the patient's perspective.
Well, when you look at the technology that Healtheon supplies to the clinic, the patients can book their own appointments. They can talk to an AI-enabled chatbot. We're adding a conversational bot so they can talk to a digital assistant. They can request prescription renewals or tests, etc., etc. And so it'll be an expedited, accelerated access point through technology for patients. And once they're in the practice, if they require a cardiologist or a lung doctor, a pulmonologist, that will all be available to them on an expedited basis as well.
So it almost seems that Healtheon is making access and triaging, I guess, healthcare more pleasurable for the patient.
Absolutely. Right now it's a slog and it's complex and everything is siloed. So we're bringing it all together in a holistic solution. And we're pretty excited to roll this out. There's only 45,000 family doctors out there that we want to talk to. But I think they're all going to be very excited about modernizing their practices and enjoying the practice of medicine.
Switching gears a little bit, when we talk about startups, this is your second time around. I'm curious, how did your experience with founding RCM Health help shape your approach to founding Healtheon? Like, what aspects worked very well, and are you carrying over to the Healtheon brand?
Yeah, so I've always been interested in new ventures, and in fact, after I got my MBA, I spent 6 years in investment banking helping to finance startups. I've spent decades coaching entrepreneurs in how to shape their startups. And so Healtheon is kind of my finale, where I get to drive the bus a bit. We've got a great team, and I really enjoy leading the team and helping hopefully millions of patients.
It's pretty amazing to be starting such an impactful company so late in your career. What's your why?
Well, it's, over the last 40 years, I've seen the erosion of primary care. Many primary care doctors are dropping out. And I really think we have a mission, important mission, to help stop the erosion of that service and improve it dramatically.
And I think the key tagline is, we're setting a new benchmark for healthcare in Canada.
Absolutely. We want to deliver excellence, and that's what we're all about.
Thank you, Raymond.
Thank you, Tanya. Appreciate it.